A healthy mouth is essential for doing a lot more than just eating, talking, and maintaining basic social interactions. Having dental issues can lead to pain and discomfort, which individuals' ability to work, participate in social activities, and affect their self-esteem. The first are the psychological and social impacts of having poor dental health. When talking to somebody who has visibly damaged or missing teeth or has other oral health problems such as mouth odor, you tend to pick that up immediately. And this could be in social settings such as the workplace, in school. And so people who have these problems tend to feel very self-conscious, especially as we live in a society that places a lot of focus and attention on presentation. And so society places this judgment or stereotypes on people that suffer from poor oral health. And these judgments go on to manifest in their abilities to get job opportunities. In some professions, especially those that require a lot of in-person interactions, either with clients or with colleagues, this becomes a problem. And when it comes to dating and finding a romantic partner, oral health is often associated with overall health and personal hygiene. Patients that have diabetes tend to be more susceptible to gum disease and infections. The reason for this is because people with diabetes experience slower healing than people without. You also want to look at individuals that suffer from disability. A person suffering from disability does not maintain the same sort of control over their bodily functions and habits as able-bodied people. And so they may need a little more assistance with oral hygiene. They may need a little more assistance with, and they may also not be able to always communicate their needs. So they may need help with anticipating some of these needs that they have. There are also people who suffer from eating disorders. If you are somebody that suffers from an eating disorder, especially one where there's a lot of frequent vomiting or purging, this can lead to real decline in oral health. The reason for this is vomit contains stomach acids, which lead to erosion of the enamel. And this can lead to tooth decay or sensitivity. Also, eating disorders can lead to deficiencies in certain vital nutrients such as calcium and vitamin D, which are all essential in maintaining healthy teeth. When it comes to health inequities, people who often have bad oral health tend to be from lower economic backgrounds and may have limited access to proper dental care. This can go on to perpetuate cycles of poverty because people with poor dental health coming from lower economic backgrounds don't have access to the right job opportunities or to the right dating opportunities that can help them elevate their social status. Celebrities get their teeth fixed as soon as they become a lot more prominent. One of the things that is really important when we're talking about dental care is professional dental care. This is a really important part of taking care of your teeth. Getting access to the right dentist at the right time could be life-changing for a lot of people. And the reason for this is dentists are doctors of the teeth. Their job is to detect early dental problems and provide the adequate care when necessary. Some of the early dental problems that they detect include things like gum disease, cavities, and even certain oral cancers. These are things that you cannot assess on your own, which makes access to a dentist really important. Another thing dentists do is they help professionally clean your teeth. Getting access to professional cleaning gives you an additional layer of hygiene which you cannot achieve by yourself. Dentists are able to use specialized tools and equipment to get into various nooks and crevices which your toothbrush is unable to get into. Another thing dentists offer is preventing tooth loss or replacing lost teeth. If you suffer from gum disease or have an accident that causes you to lose a teeth or your teeth to erupt, dentists are able to pull out any loose tooth and either replace those or figure out how to make your mouth more functional. Dentists also provide highly tailored and personalized advice to patients in accordance with updated dental practice. They also know the best products to recommend based on your needs. Another important benefit of going to a dentist regularly is that it prevents the need for more expensive dental procedures down the line. And that's because your dentist is able to catch any problems early, as opposed to you going to see your dentist at the very last minute when you may have had a fixable problem. However, there is a big problem with dental anxiety, especially in the United States. This is a problem that prevents a lot of individuals from seeking timely dental care, and it usually arises from a variety of reasons. Patients may have had bad dental experiences, and so they don't want to go back. There is also the fact that a lot of the times going to the dentist is associated with pain, which causes a lot of people not wanting to visit their dentist. A few strategies to address that is to keep an open communication with your dentist. If you have had a bad experience with your dentist, it's okay to change your dentist or find a different dental hospital to go to. And it's important to build long-term trust with the dental teams. That helps you build a really good rapport. It's easier for you to communicate your needs, easier for you to be open. If you're not having a good experience, it's also okay to change your dentist as needed. Another thing you can do to relieve dental anxiety is to start small. You don't have to go get a filling the first day you go into a dentist's office. Start with a routine checkup, and then you move on to a teeth cleaning, and you gradually build up your tolerance to the dentist as you get more comfortable with being in that setting. Pain is one of the biggest reasons why we see people hesitant to go into dental checkups. If you're somebody with a very low tolerance to pain, you can always opt for sedation. What this means is whatever dental procedure you're going in for, you can ask for sedation techniques like nitrous oxide, which helps with reducing your perception of pain, or even just getting full anesthesia or local anesthesia depending on the dental procedure that you are undertaking. I cannot stress enough the importance of choosing the right dentist. You may find yourself in one of these situations where you have to move across multiple dentists, and that's okay. Finding the right dentist is probably the most important thing you can do for your oral health, as the right dentist will help you with long-term care as well as addressing any immediate problems that you may have. Now let's talk about the normal things you will hear when it comes to taking care of your dental health and why this is important in the first place. Brushing your teeth and flossing are considered preventative dental measures which individuals perform in between professional dental care. It's important to brush your teeth twice daily, preferably using fluoride toothpaste, and floss in between your teeth at least once a day. This helps prevent plaque or any food buildup that you may have accumulated during the day, which could lead to bacterial growth. The reason for recommending fluoride-based toothpaste is because fluoride has been scientifically proven to strengthen your enamel and prevent early signs of tooth decay. Other things you may want to do is limiting your intake of acidic and sugary foods. This is because bacteria need sugar to survive, and this can lead to tooth decay. And acidic foods and beverages such as citrus and sodas also erode your enamel, which can lead to an overall weakening of your tooth. Another thing you may want to incorporate is to avoid frequent snacking. Because frequent snacking increases the risk of cavities, it gives bacteria more opportunity to produce acid and feed. If you want to snack in between meals, opt for healthier options or fruit as opposed to sugary foods and beverages. Now let's talk about gum disease. Gum disease is one of the most popular dental problems that affects a lot of people. Preventing gum disease is one of the main priorities for your dental team or your healthcare team when it comes to maintaining overall dental health. Things you can do to prevent gum disease include limiting alcohol and tobacco consumption. This is because smoking reduces blood flow to the gums, and this in turn reduces the ability of the gums to heal naturally and also increases the likelihood to accumulate plaque on your teeth. You also want to manage stress. Stress can lead to dental problems such as teeth grinding. Teeth grinding can lead to gum recession, which can lead to gum disease. And so if you're somebody who grinds your teeth out of stress, you want to make sure that you're putting on night guards or Invisalign to prevent your teeth from grinding. And if you already have gum disease, work with your doctor or your dental team of antimicrobial treatments, which can help limit the spread and proliferation of any bacteria that is already present in your mouth. Also, check for any additional medical conditions that can be exacerbated by gum disease. For example, diabetic, that puts you at a higher risk for getting gum disease. So keeping track of your overall health and other health conditions is important when it comes to managing gum disease. Let's dive a little bit more into the implications of tobacco and alcohol on dental health. Both substances can have a wide range of implications on oral or dental health that range from cosmetic to other more serious medical implications, like oral cancer. Smoking and tobacco drastically reduce the amount of blood flow that goes into the gums, which is why smokers tend to have a lot of tooth loss. When you see the mouth of somebody who smokes, have a lot of missing teeth, or they have a lot of stains on their teeth, that's because this reduction in blood flow means that your gums are unable to fight infections, which creates opportunistic breeding ground for tooth-eating bacteria. Another thing that comes with tobacco consumption is bad breath. If you've ever been around somebody with bad breath, you know that it's not a fun experience at all. And alcohol consumption causes something known as dry mouth. And dry mouth, simply put, means a reduction in saliva production. And saliva is really important because saliva contains enzymes and bacteria that are useful in the prevent against tooth decay. Certain alcoholic drinks as well, such as wines and beers and cocktails, contain acids that can erode your enamel. Biggest risk for alcohol and tobacco is cancer, and so if you're trying to prevent any sort of oral cancers, you need to limit your alcohol and tobacco consumption. We also need to talk about the general implications of having poor dental health. There are scientifically proven direct correlations for poor dental health and other associated healthcare conditions such as heart disease. This is because bacteria from your teeth or from your mouth can travel directly into your bloodstream and cause problems such as a heart attack or a stroke. Pregnant women as well need to pay a lot more attention to their oral health, as hormonal changes during pregnancy can lead to problems such as gingivitis, which is a milder form of gum disease. It's even been proven in medical studies that women with severe gum disease have a higher chance of giving birth to babies with lower birth weight. Also, there is research that shows that there is an association between gum disease and certain cognitive problems such as Alzheimer's. Finally, there are also certain cancers which are directly related to dental problems, such as oral cancer, tongue cancer, lip cancer, and cancer of the cheeks.